Even until this day, I can say the friends that were with me, I'll call them my day ones in high school. They're still my best friends till this day. So,
Yeah.
yeah, high school, no idea. They went into sciences, therefore I went into sciences. Um, your parents, some parents might say, okay, well, if your friend is going to jump off the bridge, are you going to jump off a bridge? Yeah, I probably would, actually.
Yeah.
I probably would because I trust them. I
Yeah.
trust them, I know them, and I know there's something good at the bottom of that bridge. You just don't know, Ma. You just don't know.
You just don't know. Real Talk with Star Scorpio, episode 108. I met my guest today, Dr. Paul Seto, chiropractor and acupuncture provider, at a seniors work event. We struck up a conversation. Come to find out, we actually went to the same high school, Victoria Park Secondary in North York. I mentioned to him that I was having some terrible shoulder pain. He explained clearly and simply how the shoulder is made up, the rotator cuff, the muscles, the tendons. He explained it so well, I was impressed. He did a quick assessment on me, and after visiting him a couple times, I'm proud to say, Paul, my shoulder is 100% because I started my journey with you. Welcome to Real Talk with Star Scorpio. How you doing today?
Hey, Peter, I'm so glad and happy to hear that you're doing so much better than when the first time we met. And thank you so much for having me on this podcast. It's my pleasure to be here.
Right off the bat, I want to know how it feels when a new client like myself comes to you. You have all this experience, so you know how to treat someone because you know the injuries and what's involved in the treatment process. How does it feel to you when you know that you know how to help me, for example, in my situation, and me myself thinking, I don't think this will ever heal, but you know there is a method to treat me? How does that make you feel?
How does it make me feel when I know how to help you when I'm talking to a person who feels helpless?
There you go.
Uh, I would say a little bit of excitement. I think that would be the best word to use in this situation, um, because I know the answer to most things, right? Not always do I know the answer. That's the point of a kind of multidisciplinary health care network that we have in our clinic and in Canada. If we don't know, then we will refer you to somebody who I think can better handle the situation. But uh, it's very exciting to me to be able to bestow upon a patient who's lost all hope in telling them and educating them and physically being able to get them back on their feet. Uh, there's a great sense of joy in that as well, empowering the patients and giving them giving them the power back again to live their lives to their full potential.
Yeah. See, this is what I want to hear because, the example I use is a personal trainer. A
Mhm.
personal trainer goes to school, they understand anatomy, how the body works. And when it comes to someone, say, that wants to lose weight and gain muscle, you know the calorie intake, what exercises you need to do, and they can get you where you want to be. But
Mhm.
that person coming to see them feels hopeless and they might not think they can lose weight. But that trainer says that word, they're excited because they know they can
Mhm.
transform your body. But
Mhm.
there's one thing, and I think you told me too, any trainer knows, any doctor knows, they can provide the tools, but it's that person that actually has to believe and do the work on their end.
Yeah, I think the biggest hurdle that comes from trying to overcome something like this is you're looking way too far down the line. A lot of people unfortunately expect an overnight result, almost like a get rich quick scheme. But you and I, most people know that there aren't really any shortcuts to success, and the road to health is nothing different than that. It's so hopeless because you're always looking at the finish line and at the top of the mountain, and of course, from where you stand right now, that's a far distance away. It does seem almost impossible, but just like most things worth having in life, there's a grind associated with it, training for a marathon, climbing the Mount Everest or Fuji, even more realistic goals like graduating from school or getting into a program. Health and wellness is almost the exact same thing. Everything is very stepwise. All improvement comes in increments, and when you're in the neck of the woods, the when you're deep in the forest, it's very hard to see. But when you finally get to the finish line, you'll actually see how far you've come. And uh, yeah, that's the main takeaway from this is that it's possible, as Kevin Garnett says way back in during his championship run.
Yeah.
Anything is possible. Not anything, but this
Yeah.
this is very possible.
Yeah. Thanks for sharing that. Okay, now let's rewind. We'll get to that stuff a little later. So I like to start from the beginning. So first, Paul, let me learn a little bit about you. Where were you
Cool.
born and raised?
I was born in East York. Born and raised East York. I moved when I was second grade, and then born and raised and stayed in Scarborough ever since, up until now, essentially.
Yeah.
And
Yeah.
we went to the same school together.
Yes. Let's rewind back. That was high school. But tell
Yeah.
me something. First, I want to know about your home life.
Mm.
Do you have siblings?
Yeah. Yeah.
Yeah.
Just
Eh,
one
Just one sibling. Brother, sister?
sister.
Yeah. Older, younger?
Older.
Okay. And parents, did you
Hmm.
come from a strict household or more relaxed?
I would say pretty strict. Pretty strict. Um, Stereotypical as much as you'd like to call it. Yeah, very traditional Chinese family.
Hmm.
Lots of rules.
Lesser rules.
Lots of expectations.
Yeah. So when it came to the studying then too, right?
Oh, you know.
Yeah.
You already know.
Yeah. So when you were in school now, were you a quiet kid? Were you more introverted or extroverted?
Uh, Definitely introverted
Mm,
in our household and I guess maybe even culturally, it's more like, you only speak when you're spoken to type of thing,
mm,
right? Uh, Not in like an abusive way, but it's more like, yeah, there was a very established hierarchy, I guess you can say, and you got to know your place.
yeah.
And, when you get out of line, then, there are consequences to that.
Mm,
So, yeah, you learn from an early age that, yes, you should shut your mouth.
yeah. Were you expected to get those grades, those A's,
Yeah,
those that?
absolutely.
Yeah.
Absolutely.
Mm,
It's eh, they come from a good place.
mhm,
I have parents that uh, never got the opportunity to have the education that I had, and they immigrated here in their um, mid late adulthood,
mhm.
and they sacrificed everything so we could have it all. So um, there's there's a want and a dream for you to succeed, but it also comes with the expectation. But at the same time, their upbringing, they had different struggles,
Yeah.
right? Our upbringing, of course, we have our social circle and our school struggles, but they've never experienced school the way that we've experienced school here. They'd never studied as far as we have. Uh, they have never studied the content that we have. So, in their eyes, they can't really see the difficulty of the material that we study and how hard it actually is to sometimes grasp. Eh, but it still comes with the expectation of why did you only get a B? Why
Yeah.
is this a C? That's an outrage. So yeah, there were expectations, but I it, it was I know it's difficult for them to understand where we're coming from,
Hmm.
and why it's so difficult for us. But yeah, there are definitely expectations, and I try to see it from their standpoint as well. But I still do my best. That's really all. And
Hmm.
ultimately, at the end of the day, even if I didn't accomplish what they expected, which is straight A's, as
Yeah.
long as they knew that I put in the maximal effort that I
Yeah.
could, then there were no problems.
Tell me something. Did you, at the time when, say, you brought home certain grades
Hmm.
and they weren't, they were a little bit upset because they wanted you to get higher marks.
Hmm.
Did you feel, I don't know if the word resentment, I think what I'm getting at is when you were older, do you look back on it now and say, I understand where they're
Yeah.
coming from? Where at the time you were like, yeah, school's hard. There's some hard
Hmm.
subjects. Why don't they just get it that I'm doing my
Hmm.
best? But then you understand later on, okay, this was the whole point and everything.
Hmm. Yeah. Classical phrase, hindsight is 2020.
Hindsight is
In the
2020.
situation, you're getting yelled at, you're getting told, you're getting grounded, whatever have you, and you're like, what did I do wrong? Um, but now looking back, they only meant well. They
Right.
always only mean well. So you have to be the mature person and let a lot of things like that go.
Mhm.
Not just talking about school, but you as a parent, you probably see that too, you know?
Right.
Your parents used to parent you a certain way, and you're like, the heck? Like, I can't go out, I can't sleep over, I have this curfew, I
Yeah.
can't have my friends over, I can't close my room door, but oh, okay, okay. Now how the tables have turned. The day that you became your parents and you didn't know when it happened. So yeah,
So
you
true.
you look back on situations and you get put into these situations and you realize like, oh, okay, like I think it's a lot easier now to be empathetic
Mhm.
and see it from their perspective. So no, zero resentment there. They meant
Yeah.
well. They
Yes,
only wanted
yes.
the best for me. So
Of course. So tell me something. There's something I told you. I think I told you more than once at the event, the
mhm.
seniors event we were at, and then when you were treating my shoulder, you have this calm demeanor and personality, and I want to know, were you always like this? Because I try and take on
Mm,
your trait.
I appreciate
I'm
that.
getting better as I get older. Like I used to be always hyper and angry back in the days, but I
Mm.
just love your demeanor. Where did that come from?
I think it definitely comes from probably started with the introverted personality. You're more of a listener. You're more of an observer than
Mhm.
you are someone who jumps into things head first. Um, so that allowed me to, appraise and understand the situation first before I gave my input. And also, what contributed to that is more experience.
Mhm.
Starting my career for sure, listening and hearing patients out. Mostly, yeah, listening before you speak. I think that's very important, and just slow it down, slow
Mhm.
it down, because there's a saying, there's a quote, and I quote the great Kawhi Leonard, who brought us Toronto's only championship.
Yeah.
He has many, many signature sayings, but there's an interview that he said, and he says, "Slow is pro,
Mm.
slow is pro." And his teammate, I forgot who he was talking to, but they're all looking at him like, "Bro, why are you talking so cryptic? What are you talking about?" And he's like, "When you rush, you make mistakes. When
Mhm.
you slow down, then everything is done properly. Slow is pro, slow is pro. So I kind of take that approach. I think I embodied that even before I heard that saying from him, which
Mhm.
was only recently. But I try to take things and do things, take my time with things, take care, make sure everything is done properly, make sure that I process what I'm saying before I say it out loud. Because words words are powerful. They can affect people in many profound ways, and once you say it, it's very hard to undo. It's in
Mhm.
their memory forever. So, of course, I've lived life, gone through my trials and tribulations. Definitely said some things wrong to some people back in my youth, and yeah, it's hurt them in ways and scarred them in ways, and it's come back to me in a way where you kind of know now, like I try to be as articulate as possible.
Mhm.
So yeah, process everything first and then say what you mean.
Right
So
on.
I think that's where all that comes from.
Mhm.
Just take a deep breath and yeah, don't rush. Don't
Yeah.
rush.
So we know we went to the same high school, but
Yeah.
I'm 92 graduate. What year are
Mhm.
you?
That's a good question. 2009,
2009. Wow.
I believe.
Okay. And now
Yes.
tell me, your last year of school, did you know what you wanted to go into?
Nah,
What tell me that journey. Like in grade 12, what were the courses that you were taking where you're like, yeah, this is gonna get me into this university and I'm taking this course. Tell me that journey.
you're so young, and I still feel like it's problematic. Back when my sister was in school, when she was getting to grade 13, I believe they used to call it OAC,
Oh, I see. Yeah.
they removed it right before she got there to grade 13. So she never experienced it either. But I'm going to say it's safe to assume that you did go through grade
Yeah.
13.
Yeah.
And I think it's something that's kind of worthwhile having. It gives young people, young adults, uh, an extra year of time to kind of contemplate and decide what they want to do. But now they've
Hmm.
taken it away. Okay, you fast tracked everything a little bit. It's good and bad. It's good for the people who know what they want to do, but it's also bad for people who, of course, it's all bad for people who are a little bit lost, who are
Yeah.
still finding themselves. And there's no one to say really when that journey ends, right? There are
Hmm.
people who thought they knew what they wanted to do when they were in 12th grade, 13th, and then they do their schooling, post-secondary schooling, they graduate, then they start their career, and then when they're 30, they realize I hate this job, and it's
Yeah.
making me hate my life.
Yeah.
And then you go through some midlife crisis, you buy a motorcycle or a convertible, and then you go back to school, and then you redo it all over again. So,
Yeah.
um, yeah, when I was in school at that age, I had no clue, really no idea. Honestly, I just chose the path that the majority of my friends chose, and a lot of them went the sciences route,
Hmm.
and I followed suit,
Hmm.
which goes to show the importance of really surrounding yourself with the right type of people at all stages of your life. Good group of friends, good social network, and people who are always uplifting, because
Hmm.
those are the people that will ultimately guide you to where you're headed and shape the person that you're going to be. Even until this day, I can say the friends that were with me, I'll call them my day ones in high school. They're still my best friends till this day. So
Yeah.
yeah, high school, no idea. They went into sciences, therefore I went into sciences. Um, some parents might say, okay, well, if your friend is going to jump off the bridge, are you going to jump off a bridge? Yeah, I probably would, actually.
Yeah.
I probably would because I trust them. I
Yeah.
trust them, I know them, and I know there's something good at the bottom of that bridge. You just don't know, ma. You just don't know.
You just don't know.
And and yeah, that's how the journey started. they all went to sciences. I chose the sciences, and ultimately, you have a science degree. You're quite limited. You have several routes you can choose in the healthcare field, and yeah, go ahead, close your eyes and pick one. You can
Mm,
aim for one, but it might not work. So have a fallback plan, and as long as you're working towards something, everything will work out in the
yeah,
end, I'd say.
yeah.
So yeah,
Where did you go to school?
post-secondary,
Yeah.
I went to UTSC, so right down the road. Like I said, moved to Scarborough, just raised in Scarborough, went to post-secondary in Scarborough, and just never leave. This is home base.
This is home
Always
base
will
for
be, I
you.
think.
Hmm. Okay, so now how did you start your journey, your career
Uh,
in chiropractic?
so how did I end up in chiropractic?
How did you end up in
What you're
chiropractic
asking?
medicine? Yeah.
Yeah, I guess we'll go. So the story I just told you had a lot to do with it, but I'll start
Hmm.
from the beginning, I suppose. As a kid, I've always been, I would say, pretty artistically inclined. I loved everything hands-on,
Hmm.
whether it be drawing or painting, woodwork or clay, whatever it may be. Like
Hmm.
I was, I was, I was really into it. It was my outlet, and I think I was naturally good at it. So therefore, it just perpetuated, you know?
Hmm.
Um, but in in our household, in Chinese culture, there are definitely career paths that will not get the approval of your family.
Hmm.
So, given that my interest was in art, I wanted to go towards the arts. And if you can imagine, I would say it's pretty, maybe in your household too, to be honest. You tell your parents, like, hey, yeah, like, I want to be an artist. And they'd be like, absolutely not.
Yeah.
There's no money in that.
I get it. Yeah.
I forbid you.
Mm.
So, yeah, that was the end of that dream,
Yeah.
really. But I still pursued it as a hobby. I still did it on the side for my
Mm.
fun, not for a career, not for education, but I still did it as a pastime.
Hmm.
And then that was it for a long time, to be honest, until we got to the end of high school and university when it came time to choose your courses, like which direction you want to go.
Okay.
Economics or visual arts or performing arts, or mathematics or computer science or sciences. So, like I said, all my friends went into the sciences route.
Hmm.
So, like I said, they jump off a bridge. I also jump off the bridge because how much I trusted them and how close we were, there's no way you could really lead me astray, right?
Hmm.
So yeah, I did a neuroscience degree at U of T,
Hmm.
and I just kind of fell into the realm of health and psychology and biology, human anatomy, et cetera, et cetera. And then it finally came time to convocation day, right? Even at that point, the day I graduated, I walked across the stage. The dean handed me the diploma. I shook their hand. They like to make small talk with everyone that comes onto the stage. I know they won't remember me. I know they won't remember the conversation we had, but it's almost customary to ask anyway. I walk across the stage, they shake my hand, and they said to me, "Oh, congratulations, Paul. What is your plan now?" And the clock stood still a little bit, and I was there, frozen, and thinking to myself, I don't know. I don't know. I just spent the last 4 years studying my behind off to get this diploma, and I don't know what I'm doing with it. So there started my quarter life crisis, we
Hmm.
can call. Now I have a diploma in the sciences and a undetermined fate. So I had to sit down and really contemplate in my own thoughts and talk to all my family and friends and try to figure out where I can go from here. And like I said before, your the paths that you can walk with a science degree are pretty limiting,
Hmm.
especially the careers that are professional degrees that you need to apply for grad school for. So list them out. I mean, what could there be?
Hmm.
Med school, dental school, physiotherapist, occupational therapist, chiropractor, nurse, right? Like
Hmm.
of all those things, I mean, there might be a couple of more, but you can count it probably on your two hands
Hmm.
which route you could possibly go. So, yeah, it was time to research. So at that point, I took a couple of gap years, did a lot of shadowing, did a lot of volunteering, met a bunch of dentists, physiotherapists, occupational therapists, and just tried to figure out what I wanted out of life. And at that point, I actually didn't know what chiropractic was. And not a lot of people do,
Right.
actually, till this day. There was a statistic that was presented to us when we were still in school, and I think it stated, I don't know what the current stat is, but it said only around 10% of the population utilizes chiropractic.
Hmm.
10%. Look at the untapped market. Look at the
Hmm.
people who we could help that don't even know we exist. They don't even know what we do,
Hmm.
which I'm sure you'll probably ask me a little bit later. Explain it. Explain it to
Exactly.
someone, but we'll get to that later.
Hmm.
So one of my close friends one day suggested while we were having a life talk,
Hmm.
they're like, "Hey, why don't you consider Cairo? I have a connection. I have a friend that currently is one. Do you want to ask them a couple of questions? I'll reach out." So thankfully, he reached out and she was willing to connect with me, and we went out for a coffee. I came with a whole clipboard of questions, and I just asked her everything that she does, what her lifestyle is like, does she enjoy it, what are the upsides, what are the downs, and it came down to this. Long story short, like I said before, growing up, my passion was really working with my hands.
Hmm.
And now I also have a passion for the health sciences because that's what I've been studying for the last 4+ years.
Hmm.
And now let's break down the the linguistics of the word chiropractic.
Hmm.
It's made up of two parts. Practic, stemming from the word practice, right? Practice of. And Chiro is actually a root word derived from the Greek word hands. It means hands. So you put it together and it literally means the practice of your hands.
Hmm.
So lo and behold, here is a profession that combines what I think I was naturally gifted with the passion that I have developed later in life to present a career path where you can have both.
Hmm.
And the rest is history.
Yes. So now you're telling me you had a list of questions for your friend's friend, and you're just like, this is the path that I'm going. So what's the next step now? So you got your, it was a degree, not a diploma, right? You got your
Yeah,
degree, right?
yeah,
Right. And now you have your answers. You had a passion for art, working with your hands. Thanks for explaining that, by the way,
yeah. All
chiropractic,
good.
because you're good at that, Paul.
All
The people
good.
don't know this, but you're good at breaking things down and explaining what things mean. What came next now?
So now you know where you want to go. Now it's time to fork up the money, write an essay, find a couple of references, and submit your applications.
Okay.
Right. So Cairo School is a full on degree. It's a
Hmm.
doctorate degree.
Hmm.
It's 4 years in length. First 3 years are in-class education with practical training, and the final year is a clinical internship
Hmm.
for the entire year. And to get into Cairo School, you can definitely look it up. for sure. CMCC, Canadian Memorial Chiropractic College, is the one I went to.
Hmm.
It's in North York. There is a GPA requirement, but when I applied, I do not believe that there was a prerequisite
Hmm.
requirement. We had a student that graduated with a MBA
Hmm.
and they applied and they got in and they graduated and now they're a chiropractor. So whatever background, as long as this is your passion and your marks are good for it and the interview process goes well and they can see that you're really invested into it,
Hmm.
then hey, it's possible, right? Um, but uh, there is CMCC, that is in North York. It's
Hmm.
at Steeles and Leslie.
Hmm.
And besides that, this is a fun fact that not a lot of people know. In Canada, there are only two chiropractic colleges. One
Wow.
is in North York, which is the one we went to,
Hmm.
and the other one is in Quebec, and it is French speaking. So if you're Canadian and you want to get a Canadian chiropractic degree, you have one shot, and it's at one of these two. And if you don't speak French, then it's this one only.
Yeah.
There are other options, though. Chiropractic is widely practiced across North America, inclusive of course, the United States. There's a lot of chiropractic colleges over there, but
Hmm.
that's given, okay, you're Canadian, you apply there, um, you'll be hit with quite the international student fee.
Yeah.
And exchange rate then and now, not favorable. So,
Yeah.
if you can, of course, stay within Canada. If not, then you got to do what you got to do, right? The end justifies the means. If this is your ultimate goal, hey, go for it. No regrets. So,
Hmm.
yep. In terms of
Did
next necessary steps, it was application. I think they take applications. You know what? I actually don't remember when applications are. It should be online, but you apply and then you gotta wait.
hmm.
There's only one application cycle a year. So if you miss it by the window, you gotta wait for the next year.
Oh, wow. Yeah.
You apply, you wait, then you do an interview.
Hmm.
The panel interview, from what I remember, there's three of them. It might be online after COVID happened, to be honest, but three panel interview. One is a staff member, one is a chiropractor, and one is a just I forget,
Hmm.
just a member of society, maybe.
Hmm.
All right, they assess clinical situations, maybe what you would do in certain situations, more character, um, personality questions, just to make sure that you are a good fit
Hmm.
to be in this role. And then you wait again. You wait again, and then the fateful day, they send you an email and they let you know
Yeah.
whether you're in or you're out.
Hmm.
And I was fortunate enough to be one of those people that got in, and here we are.
Yeah. You mentioned that you needed references.
Yeah.
Who were the references from?
Uh, I think they I think they preferred academic references at
Oh,
that point. I
okay.
think they wanted professors to speak on your behalf.
Hmm.
But I do believe anybody who's a professional would suffice.
Okay.
So
Yeah.
anybody that can speak well on your character and your work ethic.
Hmm. So I want to ask a question. We're gonna get into the chiropractic questions, but I do want to ask a question. How did you feel with your friend group? I had this problem of feeling, oh, how do you say it? I don't know if it's envious or I wish I was at the point where some of my friends were at. I started my career late in life. And when I say late, I still mean like mid 20s when some of my friends were in professional careers already and I'm here struggling. And it's like, damn, I feel like I'm playing catch up.
Yeah.
For you and your friends, where were you in that rat race?
Yeah, it's definitely behind too, I feel like. But it's all perspective. Everybody has their own pace in life.
Yeah.
They all go through their own process. They all have their life events, their tragedies, their successes, and you have to come to the point and realize comparison is the thief of all joy. You keep comparing yourself to everybody who's got more or is doing better, and you keep scrolling on Instagram and see the picture perfect Instagram models who may or may not be photoshopping all their pictures, editing all the videos, but you see a facade.
Mhm.
You see only the good things. People only want to show you the good things, and you think that's all there is to it. But they went through their struggles too, all right? Their life is probably not all as well, maybe not as all as well as you thought it would be.
Mhm.
So one is you got to throw that out the window. Ego is a killer of dreams. You gotta dig a 6 feet grave and bury it and never visit again.
Mhm.
And stop comparing. Stop comparing to people because you never know where they're actually at. They could look successful, but you know, sometimes those are the people with the highest stress and the most mental illnesses and with depression and, a whole bunch of stuff that's under the cover that you don't know what's going on. So, number two is never compare yourself.
Mhm.
And three is always perspective. Perspective in that, okay, they got more than me, but look, I got way more than all these other people. Not to say that I'm better, okay? That's not
Right.
what I'm getting at, but it's perspective. All I'm
Mhm.
saying is be grateful.
Mhm.
Be grateful. It could be worse. It could be worse. And those are three principles I say that I try to live by. It puts you in a way happier place.
Yeah.
And if they are your friends, resentment shouldn't have a place in that relationship
Yeah.
because they're your boys or they're your girls. I root for them.
Mhm.
Your success is also my happiness and success because when they're up and you are good friends and you spend a lot of time with each other, they will lift you up as well.
Yeah.
So those are those are my life lessons.
Yeah. Yes, sir. Okay, let's get into this. Chiropractic. So the first question I'm going to have for you, right? So might have listeners that don't fully understand what chiropractic treatment medicine is.
It's
For
common.
someone who doesn't understand what chiropractors do,
Yes, sir.
how would you describe your role in simple terms?
So I'm going to do it as concise as possible. I think this is a pretty common definition across the board if you asked any chiropractor. So first things first is we are primary primary healthcare providers.
Mm,
Primary meaning you can come to us directly.
mm,
You do not need a referral. You do not need to go to your family doctor first. Just call in, walk in. You'll be able to see us right away. So primary care. And then what the heck do we do? We are healthcare providers that diagnose, treat, and try to prevent musculoskeletal conditions
mm,
in a as holistic way as possible, treating the whole body without the use of medicines, because that is not within our scope of practice. We do not prescribe anything other than exercise
mm.
therapy. So anything that is muscle related, joint related, tendon related, ligament related, those are all things that are within our realms. So that is what chiropractic is. Any bodily ache that you have, we are the go-to people, especially if you want to stop abusing all the Advils and Tylenols and
Yeah.
things that are tearing up your guts.
Yeah. Yeah. Thanks for sharing that. And
Mhm.
when do you think someone should actually consider seeing a chiropractor? Like what signs or symptoms? And before you answer that, I go back to what I said in the beginning.
Mm.
I kind of gave up, and I'm so happy that I met you because I've been to chiropractors before. I've been to
Hmm.
massage therapists before. This injury in my shoulder was so bad. I thought it was over and I thought I just needed time. So I just stopped exercising and I was
Mm,
taking medication,
mm.
Aleve, Advil, Tylenol. And then I came across you at the event and I mentioned it to you. And I thank God for seeing you because I don't think I would be able to do this right
Yeah.
now without pain. But when should someone consider seeing?
Literally anytime.
Mm,
You could have a acute injury, which happened very recently. It could be a chronic injury that you've had for a long time. Uh, it could be for exercise prescription. A lot of patients come to me because they're looking to get back into shape and get fit again. And you would think, yeah, I would go see a personal trainer for that. But we are literally the jack of all trades as a
mm,
chiropractor. We do so much that that is unknowing to the general public. And especially when it's like, yeah, this is definitely in my scope of practice and in my wheelhouse. I can assess your form, correct it if needed. I can prescribe exercise to you. I can teach you how to work out. I can teach you what to do for certain goals. And it blows their mind when I'm like, yeah, you can go hire a personal trainer for $100 a session, or you can come see me and use your insurance money. And they're
yeah.
like, what? I can do that? I'm like, yeah, it's totally within our realm of practice, you
Mm,
know? And they're like, dang, I'm game, sign me up. So it could be for rehab stuff, it could be for post-op stuff. Um, Even if you don't have a problem, this is a misconception that a lot of people have is that I need to be hurt to go see my chiropractor. And that is not the case because beyond acute injuries, we do way more than that. We do just general posture. We do general consultation. Even if you had any questions about your general health, we can help
mm,
you with that. Some people have postural concerns. Oh, I sit like this, or I feel like I'm always slumped. Yeah, we help with that. Ergonomics assessments, right? Workplace or work from home people now, your desk, your chair, all that stuff. Yeah, we can do that as well. Even general stiffness, soreness, tightness from overuse, we
mm.
deal with that as well. So yeah, there's never a wrong time for you to see a chiropractor, even if you're feeling like you're doing well, and there's nothing technically wrong, because we as the professional, I think we are very highly skilled and trained to
Mhm,
be able to not just treat injuries and problems that are evident, but
mhm.
we are also very good at finding issues that you may not even realize are happening.
Yeah.
And we find the problem, we explain it to you, educate you so that we can prevent the problem from happening at all to begin with.
Mhm,
So, one way to kind of look at this is how you would frequent the hygienist at your dental clinic, right? You go in every 6 to 9 months. You go in whether you are hurting or not. They clean you up, all right? They take care of things, and if they do find something, they'll call the dentist and they'll fix you up.
right.
But if they don't find anything, at the very least, we checked for it. We made
Right.
sure, and we did some maintenance work in the meantime, which is the cleaning. The
Mhm,
maintenance work that we will do, kind of the same thing, but it's more maintenance on the body,
mhm.
keeping you in good health and keeping you moving well, so that you can continue to live your life to the fullest.
Yeah.
So anytime, see us anytime.
Yes. And
And yeah, good.
currently, you work for
Yeah,
Amity Health in Scarborough.
yeah.
What are some of the common injuries that you
Mm.
treat or conditions? And it could be all over the map, but I'm just wondering if it's something to do with a body part that we commonly use. So
Mm.
they walk in and you're like, yep, another shoulder injury, a lower
Uh,
back injury.
bread and butter, it's mostly spinal injuries.
Okay.
Low back, low
Mhm,
back, like yours and your
mhm.
wife,
Yeah,
where you have told me briefly about just backs giving out or you overdoing it, um, and you can't walk for the next 3 days. That's
right.
very common. The next one is neck injuries, also
Hmm.
along that spine, of course, mostly from repetitive tasks, working,
Hmm.
computer work, being on your phone, reading, studying for long periods of time. Uh, that definitely puts a strain on the neck, and that's a very common injury that I deal with as well.
Hmm.
So
And
mostly repetitive strains and sprains.
right. And when you did a quick assessment on me, it's just again, this goes back to your knowledge and you're looking at someone, you're like, I can treat you. I know what to do. So you did an assessment on me where you put pressure and I tried to raise up and then this
Mm,
way. And then
mm,
I felt the pain, I think, when I raised up or whatever.
mhm,
So when someone first comes to see you at the clinic,
mhm,
what is a typical first visit like?
So first, you're always greeted warmly at the door by our lovely reception.
Yeah.
Um, they will take down a few jots of information. There's some further intake forms that you would typically do to come in. And if you do have the insurance and you would like us to, then we get down your information for your insurance and we can do direct billing and they take care of all of that. And then that's all the preliminary stuff, just so we get all the fluff out of the way so we can really get down to business.
Hmm.
As soon as you're done all that, then I'll come out. I'll introduce myself first because my look changes all the time, it seems. Last time you saw me, I didn't
I
have
didn't have
this.
that. Yeah.
Yeah. So a lot of times people come in and like oh, you're my doctor. Oh, you look nothing like the picture on the profile online. I'm like, yeah, I just like to change it up. But I greet, I introduce, and then I bring them into the treatment room behind the privacy of closed doors, of course, because confidentiality is key.
Hmm.
And as soon as they come in, I want to make sure I want to know if they've seen a chiropractor before, so they
Hmm.
know what the process is like. If they have, then it'll be a lot more smooth sailing, less explanation required. But if they don't, we'll pretend that they don't. Then
Hmm.
I'll give them the breakdown of what we do. And for the sake of this interview, whether they have or haven't, of course, I will tell you what is lies ahead. I'll tell them first, we'll do a comprehensive history taking to get a better understanding of you and your injury and how it occurred. And then moving forward, we will take that information and perform a physical exam. And the point of this physical exam is exactly what you were doing before, right? I'll do
Hmm.
this, push on this. It's for me to try and reproduce the pain. And when I
Right.
say that, it sounds like I'm evil, right? Like I'm trying to hurt you. But yes, there is a little bit of truth in that because I am trying to hurt you, but not in a malicious way.
Hmm.
If I can make the pain return with a specific motion or by pushing on a specific structure, I know what the cause of your pain is.
Hmm.
So that is the reasoning behind the madness.
Hmm.
And I know it's supposed to elicit the pain, but I make sure that it's clear that it's not intentional, and please don't be mad at me.
Yeah.
And if it does hurt,
Hmm.
then obviously don't force yourself to move further than that. As
Hmm.
soon as it does hurt, listen, I have my answer. We don't need to go further than that. We're
Yeah.
good. We're done. So that's the physical exam portion. And just to confirm what my train of thought was. That's the point of the physical exam. Confirm or deny my previous hypothesis.
Hmm.
And once the exam is done, it will have narrowed it down more. And that's the point I give a what we call a report of findings. I sit down with the patient. I let them know several things. I let them know what I think is going on, what has been damaged, why you feel like that, and this is the diagnosis, if I can put it into a concise manner.
Hmm.
Uh, then I give them the floor, ask them if they have any questions, and I'll answer everything that they might be unsure about. And then after all is said and done, um, I will tell them how I, as your healthcare provider, can try and help you with this situation. And I'll list out all the treatment methods that I will propose to them and the treatment plan, when I will see them, how often I see them, and if possible, give them a approximate timeline of how long this problem will persist for.
Hmm.
Again, I'll take questions and I give them the floor because I do firmly believe that knowledge is empowerment. And when the patient understands the thought process and what I am doing and why I am doing it, it will also make sense to them. And they will they will more likely be on board
Hmm.
and compliant with following the treatment plan in order to get them to good health again, because they understand. So once all that's said and done, I tell them what to do. I tell them how often I need to see them, and the last nitty gritty part is the consent form. Me telling them the risks to the treatment that we're doing today, making sure that they fully understand, making sure that there are no contraindications, meaning that they don't have any conditions that will make the treatments that I'm about to perform dangerous to them.
Hmm.
So that all happens in the physical. That all happens in the history taking process, understanding your health history in general, so that I know what not to do
Hmm.
as much as I know what to do in order to get you better and not worse. So as soon as they sign their soul onto this dotted line,
Yeah.
straight to work.
Yeah.
And we perform the treatment as much as we can with the time allotment that we have remaining.
Mm. There's one thing you recommended me to do. You said that you were pretty positive that I didn't have a tear,
Mm,
right? From the assessment you gave me, but just to ease my mind, you were like, you can go to your doctor. And then
yeah,
I had the,
yeah,
was it an ultrasound?
yeah.
And yeah, there was no tear, but it's something you already knew. Is there cases where you're like, okay, you definitely want someone to get an ultrasound or x-ray done
Yeah,
because of the assessment you did and you're like, yeah, there's
for
something deeper
sure.
going on there.
For sure. Based off of the mechanism that happened, all right? If if you just woke up with a kinked neck, you didn't sleep right, and your neck is killing you,
Hmm.
it's safe to say that you did not fracture your neck in your sleep.
Yeah.
There would be no point for me to send you to the imaging clinic.
Hmm.
But if you told me, hey, yeah, I was riding my mountain bike, I made a big jump, and then I landed improperly, and I landed wrist impacted into the ground, and now it's all swollen. I'm like, yeah, I'm not touching this. You get an x-ray first before I do anything because I need to be sure that I'm not causing more harm to you
Hmm.
before I can proceed with any of the treatments that we do in here. So,
Yeah.
yeah, absolutely. History and the physical will tell me everything most of the time that I need to know, whether it is within my realm
Yeah.
or if it's not my realm. So, you can put our job pretty simply. One of our main jobs is to determine, is this normal or is this not normal?
Yeah.
We can handle normal. If it's not normal, do not proceed.
Mm.
Any question marks above your head? Better safe than sorry. Get the images first. Let's get a second opinion.
Hmm.
Let's go see your family doctor. As a chiropractor, yes, I can diagnose, but it's pretty limited because of the imaging that I can get. The only
Hmm.
images that a chiro can send you for are x-rays.
Yeah. Okay.
That's it.
Hmm.
Our association is pushing more. It would make sense for us to be able to order ultrasounds
Hmm.
and maybe in the distant future, MRIs, because that would really help with our ability to treat patients,
Hmm.
as well as put less strain on mainstream medicine because the amount of people that end up in the ER and wait 6+ hours
Hmm.
only for the doctor to say, "Oh, no tears. Oh, no fractures. Here's some Tylenol. Go home."
Wow. Yeah.
Tell me you haven't heard that story before.
Many times.
Too many
Wow.
times.
Hmm.
When really they sh the public should be educated on that. In those cases, perhaps maybe your first line of attack should actually to see your chiropractor.
Hmm.
I think there's so much room for this profession to grow, and we can help the health system in such an impactful way. We're just not there yet.
Hmm.
And that will free up the emergency room for, real emergencies. Not to say, not to belittle the pain that the patient is feeling for them to go to emergency in the first place, but saying you could wait less when you have a real medical emergency and they need to see you,
Right.
right?
Right.
So, did I answer your question?
Yes, it did. Yes. What are some of the treatments that you provide? I got introduced to chiropractic work when I was a teenager, I believe.
Yeah.
Um, and you always think
Mm,
adjustment. And then later on, when I went to see my chiropractor, I noticed they do a lot of deep tissue
yep.
massage and things like
Yeah.
that. You
Yeah.
introduced me to a new treatment. I forgot what it is. Maybe you can tell me
Hmm.
now. But
Hmm.
what are some of the different treatments? Because even acupuncture, which don't laugh at me, but I was afraid, I didn't want to get it that time. But let me know about the different treatments.
So you can see a chiro as the jack of all trades. Literally, we do almost everything and anything under the sun in terms of healthcare procedures, other than prescribe medication.
Mm,
The bread and butter of what we do, adjustments, the chiropractic adjustment, right?
mhm,
A lot of people are afraid of it. They think I'm fracturing something, they think I'm breaking something, but in reality, I most definitely am not.
mhm,
All I'm really doing with the adjustment is it is a fast, really fast, but low amplitude. So there's not a lot of movement, okay? Low amplitude thrust that allows your joint to very briefly gap in space. And I don't know if you want me to get into the physiology of all this, but essentially, when that phenomenon happens, it allows gas inside that joint that is highly, highly pressurized to come out of solution of the liquid form to become a gas again. And that phenomenon creates a popping sound. It
mhm,
is the same thing as when you open a can of soda. Let's take a Coca-Cola, for example, a 2-liter bottle so you can see through it. You
mhm,
see the Coca-Cola, you see the liquid, that's it. You know, though, there's carbon dioxide infused into that drink. It is only evident and it only fizzes when you release the pressure that has been built up in there. So as soon as you twist the cap, you hear a tss sound. That phenomenon is the exact same thing that's happening in your joint. It's just that sound has to go through a lot of tissue, fat and muscle and fascia, so it is a more muddled sound. But that phenomenon is the same, except it's not carbon dioxide in our joints, it's nitrogen gas. So that is what we're doing in the chiropractic adjustment. Nothing is being broken. We're just releasing a lot of pressure in there that would in turn lead to a lot of bodily benefits in loosening up the joint, relaxing the muscles around there, and it also releases a bunch of hormones into your body that are your body's natural mechanism to deal with pain.
mm,
They're endorphins. It's your runner's high feeling hormones that decrease pain levels. So all of that is what an adjustment does. So that's definitely a a misconception that a lot of people have in the general public, but that's number one that I
Mhm.
wanted to explain very well. Number
Mhm.
two is, of course, soft tissue therapy. Soft tissue therapy can be performed with, of course, just my hands, or we have specialized tools that we can use as well. We call it instrument assisted soft tissue therapy. Some people might know it better in the public as Graston technique. Graston is a licensed trademarked name, though. So if I didn't do the course, I can't call it that. But
Mhm.
the concept is generally the same. There's mobilizations, which is stretching and helping you regain your mobility back again. And then there's, of course, education that we provide. There's exercise prescription that we provide. Backtracking on what I said about drugs, we can't provide advice or prescribe medicinal, pharmaceutical grade drugs, not even over the counter stuff. However, we can provide, uh, prescribe technically natural supplements.
Mhm.
Natural supplements we can have a say in. So there's that as well. And then there's a whole whole category of modalities we call it that we can also administer. These are machines. These are um, we'll call it accessories that we can use in our practice that complement what we are already doing.
Mhm.
So now these are the tools. We can do cupping, we can
Yeah.
do acupuncture,
Mhm.
we can do electrical stimulation, right, in the form of IFC, we call it interferential current or TENS. Um, then we have shockwave therapy, which is what we use for tendinous injuries like yours in your
Mhm.
rotator cuff. And then very recently, we also got low-level laser therapy. So the list goes on. There's another therapy that we don't have. I feel like is the only one we don't. Is ultrasound therapy.
Mhm.
Not the imaging, is in the therapy form. That's the
Mhm.
only machine we don't have. Oh, we also have a flexion distraction table for,
Flexion
yeah,
distraction.
flexion distraction. So
Mhm.
tons and tons of things. Literally anything and everything you want, we can provide.
Mhm.
And the next question begs, why do you have so many tools? I only have one half an hour session with you. There's no way I do all of them.
Mhm.
But everybody is different. Their conditions are different, and they themselves are different. They respond to different treatments in a different way.
Mhm.
Therefore, we must have options to give our patient because just because an adjustment works for one person does not mean it'll work for Peter. Therefore, that's totally fine. I will never ever force you to do a particular treatment that you are not on board with.
Yeah.
That's fine. Here are your options. And then we run through them one by one to figure out which one does Peter respond best to.
Mhm.
And then that's how we move forward from there.
Yeah. Yeah, thanks for sharing that. I'm glad you didn't. I thought you were gonna make fun of me with the acupuncture.
No,
I was afraid to get those needles. You know what I mean?
no, not a lot of people like needles. It's no. So you're
Mhm.
not the only one. So we don't judge in here. We don't
Yeah.
judge. You don't want it? Totally fine. But there might come a day actually where we have actually tried everything already.
Yeah.
Nothing worked. Then I'll circle back and I say, "Hey, listen, man, we tried everything. If you don't if you don't want to try the other thing, the first thing I suggested, then the only resort I have is to refer you out.
Yeah.
It's time to go see your medical doctor and get some images there.
Mhm.
Um, and then sometimes they will concede and then reluctantly try it. And then sometimes it works, sometimes it doesn't. And
Mhm.
then, but uh, yeah, we only have to worry about that when we get to that point. And we hope that we never have to get to that point.
Mhm.
That's all.
Tell me something. Can you break down acupuncture to me? What it really does?
Yeah,
It, it-
that one is tricky because You can practice it from two different standpoints. The
Hmm.
general premise of both of them is kind of the same, but you can learn it from uh, the traditional Chinese medicine way, or you can learn it from the westernized way.
Hmm.
So, so how does it work? What's the reasoning behind it? What is the efficacy of this? TCM is a little bit more interesting because TCM, um, they have a whole different philosophy behind what they do and why they do. In traditional Chinese medicine, illnesses, without saying, okay, illnesses are definitely from viruses and bacteria and infections and whatever, but there's an aspect of TCM that believes it has to do with the earthly elements.
Hmm.
We're talking Avatar, The Last Airbender,
Okay.
water, heat, wind, earth, metal, like Pokemon, like all the types.
Hmm.
Our body has a balance of all of this stuff. And in TCM, what their philosophy in a nutshell is you have an imbalance. You're either in excess or you're in deficit of something, or you have passages that have been blocked. Think of it as chi, if you understand the concept of chakra, right? You have a life energy that flows through you, and it flows just like your blood and your nerves, and they course throughout your body, and they innervate and give life force to all that is animate, all that is mobile, that is alive. When something is blocked, therefore it does not receive this chi. Therefore, illness has fallen upon you in that area.
Hmm.
So that is TCM theory. Now, what these needles do, these needles are mediums for us to either help administer more of these elements into you or release the elements that are too high in you
Hmm.
by literally poking a hole in you like a balloon. Yeah? Pull the needle out,
Yeah.
sometimes even let it bleed out. Like
Mm.
release, release. Or there are techniques where I am manipulating the needle in a way where I'm thrusting certain energies or elements back into the body to
Mm.
rebalance, right? Equilibrium is what they're after. So that's one approach of TCM. The other one is when I said, so that was the imbalance part. The other one is when there are blockages. Yeah.
Hmm.
So basically, think of this chakra as a it's a river of net it's a network of rivers,
Hmm.
right? Flow is good, you're in good health. But all of a sudden, this damn beaver comes along and they build a dam. And you know what dams do? It will block and impede the flow of the river, and everything downstream from that river no longer receives the nourishment of life from that river. All the plants down the road will die, all the animals will start to die of thirst, everything. Okay? So, what do these needles do? There are points, there are acupuncture points that are checkpoints along the body that the needles get put into. These are the main points that these metaphorical beavers build their dams. Needles get in, break the dam, remove the needle, reinstate flow. Health is restored.
Hmm.
That is TCM theory, which is it's over a lot of people's heads, okay? If you were born here and raised here,
Yeah.
you don't believe in that stuff, okay?
Hmm.
Tell me the other theory. Okay, fine. I'll tell you the other theory because that's what Westerners thought as well. They said that's bull. I don't know if
Yeah.
I can say the word, but that's bull. They said that's bull. I don't believe
Hmm.
in that. I'm gonna figure it out because whether they believed it or not, there were benefits. There are benefits of acupuncture.
Hmm.
The Western world just needed a more concrete answer as to how it is helping people. All right.
Hmm.
So, what is it doing? They took acupuncture needles and they took human tissue and they administered the needles and looked at it under a electron microscope. Electron microscope. Like we're going zoom zoom. All right.
Hmm.
They looked at it and what they saw is as soon as the needle was administered, they saw almost immediate inflammatory proliferation of tissue in the area that we administered the needle. So, blood flow and almost immediate regeneration, which
Wow.
is mind blowing, right? So, uh, in a nutshell, for Western theory, the way that I like to phrase it is the needle creates an inflammatory response. Inflammation um, in small doses is actually very beneficial to you
Hmm.
because it draws in new blood. And blood is the carrier of all good things. The more resources it has, the more resources it has to rebuild itself and repair.
Hmm.
So, what this needle does is I stab you, it causes enough damage to that area to elicit an inflammatory response
Hmm.
that is beneficial to you, but it is not damaging enough to cause harm or permanent damage to you. And a repeated administration uh, acupuncture over the course of period of time, you will see stepwise improvement.
Hmm.
That's the biggest downside of acu though is it does take a while.
Yeah.
I say it takes a while for you to notice significant improvements. Um, but the other downside is, again, people try it. Maybe they don't try it for long enough and they decide, eh, Aki didn't do much for me.
Okay.
Forget about it.
Yeah. Yeah. You
That's
gotta
Aki.
give you gotta give things a chance.
Yes. Yes. Yes.
Before I go to the last question, I want to
Ah,
ask you about your most memorable patient, if you remember that, if
mm,
anything comes to mind. But the way you explained that is, it sounds like when you did cupping on me, I
mhm.
think you explained it kind of the same way, creating that inflammation or bringing that blood in that area. So we did the
Yeah.
cupping, right?
A lot of what we do has to do with kind of recirculating lymphatic fluids and blood flow. Um, in order to try and accelerate the rate of healing.
Yeah.
A lot of the work that we do, not just me, massage therapists as well, that is one of the principles,
Okay.
one of them.
Hmm.
And yes, that is part of the theory behind acupuncture as
Hmm.
well.
Yeah. Cool. Thanks for sharing that.
No, all good.
Okay, we're coming to the end of the podcast, but what I want to know, do you have a most memorable patient where you helped someone out and they were like so thankful till this day? They're like me.
Yes, yes, yeah.
Mhm.
There's definitely one that comes to mind.
Yeah.
Um, I would say there's a handful, but there's definitely one
Mhm.
where she I saw her husband first.
Yeah.
I saw her husband. They were referred to me by another patient, and it's kind of how our business and practice grows. It's we do good work, and then they tell their friends,
Right.
and then they tell their friends, and
Mhm.
then we just get a chain reaction. So, um, I treated a patient, and I got them a lot better. They're super happy, and then they they asked me, "Do you think you can help my wife?" She's in so much pain. Um, she's having a hard time coping with it through everyday life. Like the pain is so bad that even if you lightly tap her on the shoulder, just a tap,
Mhm.
she will jump, just screaming in agony because that's how sensitive she has become. That's how hypersensitive she has become from the chronic pain that she has been experiencing. So he asked me, and I was like, hey, I would love to give it a try and just meet her and just talk to her to see if I can help her. She was even reluctant to come in because if if someone can't even touch you on the shoulder,
Mhm.
right? How do you expect someone to do the normal day in and day out type of work that we do in the clinic? It took a while of convincing, but given how much that patient trusted me, he was able to ultimately convince his wife to
Mhm.
come in. So we met, we talked, we went through the whole process that I just told you before about what the first meeting is like with me. And I always make sure before I perform any of my procedures and techniques and muscle work or adjustments, I always kind of do a dry run, like a run through, put you through the motions first to make sure you're comfortable with
Mhm.
what I'm about to do, just warm you up to it before I actually commit to it.
Mhm.
So I just made sure she was super comfortable. And at any time, I'll let her know if it's too much, just say the word. All right. Communication is going to be the key to our success here. If it hurts too much, you tell me to stop immediately, or just push me off if you can't say it out loud in time. But after meeting me, she we I gained a little bit of her trust, and yeah, we started to proceed with treatment, and it hurt. It hurt to do any muscle work on her, and it hurt her a lot to even put her into the position to perform an adjustment. But she trusted me, right?
Mhm.
So I put her in the position, and in an instant moment, I performed the adjustment on her. Okay,
Mhm.
and as soon as I performed it, she jumped up, like she was laying face up, laying
Mhm.
down on the chiro table. She jumped up from the table. She sat upright. She took both of her hands and covered her face, and she immediately began bawling her eyes out, like
Wow.
breaking down in tears. And at that point, I'm a little scared. I'm like, oh no, what have I done?
Yeah.
But later to realize they were actually they were actually tears of happiness. Is it almost immediately after the adjustment, she felt such a relief
Mhm.
course through that area of her body that was hurting. She felt such a relief that she broke down crying.
Mhm.
And ever since then, after every successive treatment that we had, she got better and better and better.
Wow.
At the time of her pain, she wasn't working
Yeah.
because she couldn't. It was too painful. And yeah, she's back working now, and um, I'm sad to say, but she actually ended up moving across the country
Mhm.
after we've developed such a good doctor-patient relationship. Um, I treated I treated the whole family after that
Oh,
point.
wow.
Her kid as well,
Yeah.
and but she found job opportunity across the country, so she
Mhm.
moved to Calgary.
Mhm.
But every time that she is still in town, she will come back to the clinic to
Yeah.
have a treatment with me.
Yeah.
So that one was probably one of the more meaningful
Mhm.
interactions and outcomes that I can recall from all my years of practice.
That's what it's about.
Yeah.
Oh my God, this has been amazing. Um, I just have the would you rather question for you.
Oh yeah. Yeah.
I asked this to my guests now.
Mm.
Would you rather visit your younger self
Oh.
and give them advice for the future, or your older self to have them give you advice for what's going on right now?
Oh. Wow, that's a tough question. Um, I think given the position that I'm in right now, wow, it depends on what way you look at it. It's very easy for me to go back in time and be like, "Hey, yo, bro, buy Bitcoin." But uh, the future has such uncertainty that that oh man, it would be good to know what's about to happen too, to me, it's almost like the same thing. If I go, if I have my future self visit me, it almost be the same thing. It's like, oh, like it's not Bitcoin anymore, but it's like, oh,
I get it.
buy Dogecoin. Like,
Yeah.
okay,
Yeah.
sure. I would probably say at that point, then go back.
Mm.
Go back in time, speak to my younger self.
Hmm.
At the risk of my younger self being super naive and not listening to my advice anyway.
Mm.
Because who knows, if my older self came to visit me right now, I would maybe still be naive. So I say go back in time and do it that way because the the trajectory of time that my knowledge would influence would be a lot greater if I went back in time. If I told my 10-year-old self, I would still have 70, 80 years to make use of the information and benefit from it.
Mm.
If I had my older self come now and tell me half of the time is gone, my friend,
Hmm.
I would I would I would hurt my future self, be like, why didn't you come earlier? Yeah, that makes sense to me.
Hey, yo, Paul, this is the first time this this breakdown for this question, you did that wonderfully, like a master.
Yeah.
And I never thought of it that way too. Like right now, if your older self came back, there's things that he can tell you that
Yeah.
could probably get you rich.
Yeah.
But that younger one made me laugh though, man.
Yeah. I could be
Buy
rich
Bitcoin,
sooner.
man. Buy Bitcoin. Okay, now whether my guest chose their younger or older self,
Hmm.
there's four things I'm going to ask you.
Hmm.
What would you tell your younger self about money?
Buy Bitcoin. That's simple. I think everybody's punching themselves in the head, be like, yeah, some crackhead told us. Some crazy guy told me to buy Bitcoin. And they're like, yeah, you gotta buy Bitcoin, buy Bitcoin. I'm like, what are you talking about? I'm not buying virtual money. That's crazy. But
Yeah,
look at us now. Bitcoin
yeah,
millionaires everywhere. So yeah, money, I'd say invest it properly, not just
mhm,
Bitcoin specifically.
yeah,
It's all about assets in life. Buy assets because they will appreciate. Buy
mhm,
liabilities and they will turn to zeros.
mhm,
So, but still enjoy life, all right? You have money for serious things, but you also need to treat yourself.
yeah.
So, don't don't forgo that. So,
Mhm.
that's what I
Nice,
would tell myself about money.
nice. What would you tell your younger self about friends?
Friends, I say, hmm, I feel like this is a lesson that my parents would say as well. It's just always associate yourself a with good people.
Mm.
Don't get mixed up with the wrong crowd, which I thankfully wasn't, because there's also another saying that is floating around. Don't know if it's 100% statistically true, but you are the average of the friend groups that you have. If this one I don't truly believe in, but it says if you are the top successful person in your friend group, you're in the wrong friend group.
Mm.
You need to
I heard
find new
that.
friends, which
I
I
heard
don't
that.
believe in,
Yeah.
but I do believe in surrounding yourself with people that uplift you because your successes are their successes. And whenever you're in a position that is higher than someone you care about around you, you're you're never looking down on someone because you're looking down on someone. You're only looking down on them to lift them up,
Mhm.
to help them back up. You want them to get to your level. You want
Mhm.
everybody in your circle to be as successful as you are, so you you can celebrate all aspects and be there for each other in all aspects of your life.
Mhm. Nice.
So yeah, surround yourself with good people, and yeah, I think that would be my message.
Mhm. Next, nice. What would you tell your younger self about family?
Family is extremely important. Um, they are. well, I can't say the same that it applies to all families. You know, there
Mm,
are sadly broken homes out there, people
mhm,
who have, well, yeah, not whole families out there, or families that are going through some stuff. But family, for the most case, is extremely important, and the value of it is just priceless and undeniably priceless, especially my family, who has literally sacrificed everything they have and own, and in order for me to be where I am today,
mhm,
it would be it would be outright wrong for me to not not owe them everything that I am.
mm,
So, yeah, take care of your family, check in on your loved and close ones, and you have your given family as well as your chosen family. I do believe the good friends and best friends that you establish, you know, those decade long relationships that you have with those friends, literally a brother from another mother. You weren't
mhm.
born in the same parents, or you might not be in the same culture or religion. It doesn't matter skin color, but that's the brother I chose,
Mm.
and they too will be there for me
Yeah.
in my in the good times and in the bad times. So yeah, yeah, always respect, love family, and if there's other stuff going on, then love and respect the chosen family.
Mhm.
Because in this life, you can try and do everything that you want, but you can try and do everything you want all by yourself, but it's always better together, I
Hey,
think.
well said. Well said. Last thing, what would you tell your younger self about love?
Uh, you're gonna get hurt a lot,
Mm,
um, but time does really heal all. Never try to get hung up too much on any one particular relationship. It might be a little bit more of a pessimistic view of how I look at relationships, but I don't really believe there is the one out there, a soulmate, some might call it.
mhm,
I believe in compatibility, and I believe in effort. If you really did love someone and they loved you back, you should technically be able to work it out. But uh, yeah, it's really about choosing someone who's compatible with you and supports you through through all your hopes and dreams.
mm.
Yeah, that one's definitely tough. Yeah, don't
Yeah.
get too hung up on one particular person. There's definitely someone out there who is a perfect match for you. Heck, there might even be several. Um, it'll just take time for all
Mhm,
those things to come together. And once you do find the one, wholeheartedly, truly believe in working on your relationship. Because nowadays, I feel like in this new age of dating and marriage, as soon as a problem occurs, that's it. It's over.
call it quits.
Let's break it
Yeah.
up.
Yeah.
Let's get a divorce. It's not working out no more. But yeah, the grass isn't greener on the other side. It's
Mm,
greener where you water it. So yeah, work on your relationship, or maybe it's not your partner's problem. Maybe if you keep breaking up so much, look at the common factor here. Maybe
mm,
it's you, bro.
mm.
Maybe it's
Yeah.
you. Work on yourself.
Yeah.
That leads me to another point is love. In terms of love, yeah, love yourself first. I think overall of that, even the soulmate or the partner thing, love yourself, work on yourself, become a person who you actually enjoy spending alone time with.
Mhm.
Can you sleep at night? Can you live with yourself with the things that you did and do and um, all that? Because if you don't even love yourself, I think it's going to be very hard for you to convince someone that you're a lovable person.
Yeah.
Not that you're not, all right, but you'll be in a lot happier and a healthier place when you figure out who you are.
Yeah.
And yeah, I think that's key for me.
Right. Thanks for sharing that. You got
Uh,
through those. Last thing we're gonna do before the donations is
mhm,
you're gonna choose what hand you want me to read out for the Star Scorpio question.
mm. Well, we're gonna give it out to the boys who just finished up a great World Series. So we're picking the Blue Jays side. So hats off to them. They gave us quite the show. I ain't mad, okay? I'm
Mhm.
sad, but there's always next year, and at the end of the day, as we were saying before, it's just a game, all
Yeah.
right? Unless you lost a huge money line bet on them and it affected your life catastrophically, hey man, it's just a game. Just enjoy it for what it is. Move on with your life. I'm sure you have many other more important things to do.
Mhm.
So thank you, Blue Jays, for outstanding season. I was thoroughly entertained.
That was amazing. Okay. You ready?
Let's go.
What is one of the most memorable moments of your life?
Memorable moments of my life. Uh, wow, that's gonna go back. That's easy, bro. That's easy. It was a month ago. I got married.
Congrats, man.
Thank you.
There you go.
Yeah, so find
Mhm.
that partner. Um, Make sure that you're on the same page, you're in sync with each other, you have the same values in life. I think that's the most important. You see money the same, you see family the same, you see friends the same, you see each other the same.
Mm,
And then you grow. You grow
mm,
together.
yeah,
Not just relationship, but your circle and the money in your pockets. Yeah.
yeah.
But once you find that girl, you get down on one knee, quick time, and ask her the question to be your partner in marriage and in life forever and ever.
Mm,
And I don't think that day could have been more perfect.
yeah, yeah.
Everything fell into place as we had planned and predicted and hoped for, and made it official.
Mhm.
And and yeah, that's definitely one of the most important, memorable, happiest days of my life, and making the most important decision of your life
Mm.
that will affect the trajectory for the very, very long term future.
Beautiful. Beautiful. We got through it. We're gonna do the donations now.
Cool.
Congratulations on that. I
Thank you.
think
Thank you.
I think this is the second time out of 108 episodes
Yeah.
that I heard that.
That they
I've heard
said their
marriage,
wedding
yes.
day.
I think my boy from the States,
Uh-huh.
GQ, said that. Um, but yeah, like I hear, of course, birth of the kids. There's a lot of different memorable moments, but this
Hmm.
is the second time that I heard that.
Hmm.
So congrats again.
Thanks,
Okay,
brother.
now we're gonna do the donation.
Mm.
So by my hand, you're gonna see which one you want me to pop. It's the Fundraiser Warriors. It's Claws, Kawartha Lakes Animal Wellness Society. It's
Ah.
Juku Sports, my friend Kevin that has a day camp for kids. And then Liam's Mission, little boy with cystic fibrosis.
Ah.
He raises money and donates as well to things like sick kids. So by the colors in my hand, yellow, green, blue, or orange, which one do you want me to pop?
I see what you're doing. See all these good causes, and you don't have the heart to choose one over the other, so you make your guests do it. I see, bro. I see what you're doing here. You're gonna put the blame on me now. No. Okay, let's see. Yeah, we'll stick with the theme. Um, we'll stick with the Blue Jays. We go with the blue. Keep it going.
Right. Why does this always happen to me now?
No pin.
My pin. What the? Oh, there it is. Okay, episode 108.
Boom.
Star Scorpio will be donating to. Oh, yeah. I'm gonna see if you can see it when I pull it away.
I see. I see.
It's the
I see a little
fundraiser.
bit. I see
It's
a
the
little bit.
fun. It's the four little boys. They're not little anymore. It's the fundraiser warriors. Same as the
Okay.
shirt.
Ah, the
Yeah,
shirt you are wearing.
perfect. All right, Paul. This
Awesome.
has been amazing. Thanks for sharing everything. Let the people know where they could find you, where they can get help.
Awesome. So we're located in Scarborough. Our clinic is called Amity Health. It's Midland and McNichol. The address is 385 Silver Star Boulevard. We have chiropractic. We have massage therapy. We provide acupuncture, and we also recently just hired a physiotherapist as well. So, one-stop shop for all your healthcare needs. And my name is Paul, Dr. Seto. I just get all my patients to call me Paul, though. It's more of a it's less formal setting in there. So, if you have questions, by all means, just without even making an appointment, you could call in, ask for me, tell them, uh, tell them Peter sent you, and yeah, I'll be more than happy to see what I can do for you.
Nice, thanks. Do you have an IG page for, is Amity Health have
Like,
one?
Amity Health has one. Yes, yes,
Yeah,
absolutely. So
yeah,
it's Amity Health. I don't even remember it to be honest. AmityHealth.to maybe.
yeah. I'll put it up anyway.
Yeah, sounds good. So, thank you so much for having me on the podcast and featuring me. Thank you for all that you do. It's awesome, definitely. And thank you for the service that you pay forward to all the charities that you support.
Yes.
You're a rare soul, so we need more people like you to make the world a better place. So I love that you're spreading the knowledge, you're spreading the love, and that's the way it should be done.
Thank you, bro. All right.
Appreciate you.
Real talk with Star Scorpio, and we out.
We out.